Hello, we will be doing our respiratory and cardiac assessment today. Can you please tell me your name and date of birth?
Julian Bell, 9/7/2001.
And do you consent to being recorded?
Yes.
Okay, thank you. Can you please tell me where we are?
We're at home.
And the date?
June 27th, 2026.
And why you came in today?
For my exam.
Patient is alert and oriented ×4, well-groomed and no acute distress, and breathing is even and non-labored. First, I'm going to start with your chest inspection. For this purpose, I would have them take his shirt off, but for the purpose of this video, he will be keeping it on. I'm inspecting for lesions, scars, deformities. There are none, and now I'm going to assess his back. I'll have you lean forward. No lesions, masses, deformities, or scars. Now I'm going to determine his respiratory rate. I'm going to count his respirations for 30 seconds and then multiply by 2. I counted 6 respirations in a 30-second period, so I'm going to multiply that by 2, so there's 12 respirations per minute. Now he's going to continue breathing, and I'm going to assess his use of accessory muscles. There's no use of accessory muscles, and now I'm going to place my hand hygiene and gloves on your trachea. Trachea is midline, and now I will be observing for nasal retractions and cyanosis without a shirt on. There's no nasal retractions or cyanosis. And now I'm going to be assessing his chest rise and fall, anteriorly and posteriorly, symmetrical rise. Now I'm going to palpate the anterior and posterior chest. Please let me know if there's any tenderness.
No tenderness.
Then lean forward. Okay, and then deep breath. Deep breath. Thoracic expansion is equal bilaterally. And now I'm going to assess for tactile fremitus, and I'm going to have you say 99, okay?
Okay.
With each hand placement.
99. 99.
Tactile fremitus present and equal bilaterally. Now I'm going to be assessing, I'm going to do respiratory percussion. So I'm going to place my finger and then tap on your chest, okay?
Okay.
Resonance would be found over, or was found over lung fields. Timpani sounds would be found over the stomach, and then dullness would be found over organs like the liver. Now I'm going to percuss your back, so I'll have you lean forward. Resonance was found in all. Now I'm going to be auscultating, and I will be listening for lung sounds using the diaphragm. Deep breath with each stethoscope movement, please. Vesicular sounds would be found over the lungs. Vesicular vesicular sounds would be found over the lungs. Bronchovesicular would be found in the mid-sternum, and then bronchovesicular would be found in the central area. Now I'm going to auscultate the back. Same thing, deep breath sounds, please. No adventitious sounds heard, and then I'm also, as I'm at his side, assessing the AP diameter. It should be a 1:2 ratio, which there is. Now I'm going to be assessing the precordium, so he would take his shirt off. So the precordium, there's no pulsations or thrills, and then no cyanosis, and then skin is warm, and then it would be race appropriate. And now I'm going to find the PMI, so that's left side, left mid-clavicular, so I'm going to find the clavicle, and then move down to the 5th intercostal space. So 1, 2, 3, 4, and 5, so his PMI would be right about there. Now I'm going to auscultate heart sounds. I'm going to be using the diaphragm. For the aortic, pulmonic, and Erb's point, S1 and S2 are heard at the aortic site, no murmurs. S1 and S2 heard at the pulmonic site, no murmurs. S1 and S2 heard at Erb point, no murmurs. And then switching to the bell for the tricuspid and mitral. S1 and S2 heard at the tricuspid and mitral valve or sites and no murmurs. Now I will be assessing his circulation, so I'm going to feel your radial pulses, so bilaterally. Thank you. They're bilaterally strong and present. I'm also assessing for upper extremity edema. There's no edema. Skin is intact and warm. Now I'm going to assess cap refill. Less than 2 seconds. Now I'm going to assess his pedal pulses. Both are present and strong. Lower extremities have no edema and warm are intact. And now I'm assessing cap refill in his toes. Cap refill is less than 2 seconds bilaterally. And all of the findings were normal unless stated otherwise. And this concludes the video.